Cannabis was first cultivated in the Chinese culture back in 4000 BC. Marijuana is the commonly known name of cannabis. Marijuana is the name that the Mexicans have given cannabis. Other names that cannabis or marijuana is known by are dope, weed, herb, grass, ganja, pot, hashish, and hash. Marijuana is classified as a depressant and a hallucinogen. The different ways that marijuana can be used is by smoking, eating, and intravenous injection. The main ingredient of marijuana is THC. This ingredient is the mind-altering aspect of this drug. Once taken, this drug can be anywhere from 1 week to 90 days in a person's system. Hemp is a relative of marijuana. Hemp is the fibers in the stem of the marijuana plant and is popularly used for ropes, clothes, and paper. The Declaration of Independence was originally written on hemp paper, and George Washington and Thomas Jefferson both grew hemp. There are different sociological effects of marijuana. These effects can range from a rapid heartbeat, increased blood pressure, increased breathing rate, red eyes, dry mouth, increased appetite, also known as the munchies, and also a delayed reaction in time. These effects start to subside after 3 to 4 hours, but the effects can linger up to a month. Even though these effects may not be as strong, there is still an effect on the body. So even if a person has not smoked or eaten any marijuana in the past week, there is still a chance that the body is being affected. There are also different psychological effects of smoking marijuana. The main effects of this drug are euphoria, anxiety, calmness, and paranoia. The other short-term effects of this drug range from distorted sense of time, magical thinking, short-term memory loss, and depression. These effects are similar to the sociological effects in the sense that these symptoms can diminish in intensity after a few hours, but the effects can last from a few days to a few weeks. More about the effects of marijuana. Some of the short-term effects are sensory distortion, panic, anxiety, poor coordination of movement, lowered reaction time, and after the initial up, the user feels sleepy or depressed, increased heartbeat, and increased risk of a heart attack. Some of the long-term effects of marijuana are reduced resistance to common illnesses like colds or bronchitis, suppression of the immune system, growth disorders, increase of abnormality structured cells in the body, reduction of male sex hormones, rapid destruction of lung fibers and lesions to the brain that could be permanent, reduced sexual capacity, study difficulties, reduced ability to learn and retain information, apathy, drowsiness, or lack of motivation, personality and mood changes, and inability to understand things clearly. More effects for females are infertility. Females also have a lower libido, a higher risk of infant mortality, and a higher risk of infant birth defects. Males can go down from low sperm to 0 sperm while they are using marijuana. Marijuana has now been pronounced one of the most popular drugs in our society. No matter where you go, where you turn, you're probably going to cross by a weed head or someone who uses marijuana. These drugs can be purchased legally in a couple of states, the most popular being California and the newly found Colorado. Soon to be on this list could be Minnesota, as they are going through different laws and different judges in order to pass the bill to use marijuana legally for medical purposes.
According to priceofweed.com, the average cost of marijuana in North Dakota for high-quality marijuana is $391.23 per ounce. For medium-quality marijuana, it is $351.03 per ounce. For lower quality of marijuana, it's $334.13 per ounce. These numbers are in the top 3 most expensive prices in the United States of America. These numbers are so high mostly because of the western part of the state where all of the oil fields are. The website says that a half ounce of marijuana is $240 in Williston, North Dakota, which is the city with the most oil rig workers. There are so many workers and their salary is very high, so that of course bumps up the cost of marijuana. The supply is low and the demand is high in the oil fields across western North Dakota. The current average price for the United States of America is very expensive for how popular the drug is. For 1 ounce of marijuana, the price is $297. When using marijuana and taking other drugs at the same time, the side effects of the drug intensify. For example, if someone is on an antidepressant and they smoke marijuana, their heartbeat will be abnormally fast. They could get very dizzy, have anxiety and panic attacks, get drowsy and nauseated, and be very confused. These are side effects of antidepressants. But when marijuana is used with the drugs, these side effects are more likely to happen, and when they do happen, they are more intense. Marijuana affects that parts of the brain that influence pleasure, memory, thinking, concentration, sensory, and time perception, and coordination movement. Some of the effects that happen when using marijuana are some altered perceptions and mood, impaired coordination, difficulty with thinking and problem solving, and disrupted learning and memory. So when under the influence of marijuana, driving is definitely dangerous. All of the parts of the brain that are affected have a lot to do with driving.
The main active ingredient in marijuana is THC. It is a psychoactive ingredient. The highest concentrations of THC are found in the leaves and flowers. When marijuana smoke is inhaled, the THC rapidly passes from the lungs into the bloodstream and is carried to the brain and other organs throughout the body. THC from the marijuana acts on specific receptors in the brain called. The THC content in marijuana has been increasing since the 1970s. For the year 2007, estimates from confiscated marijuana indicate that it contains almost 10% THC on average. There are many other chemicals found in marijuana which may be also adversely affecting health. People of all ages use marijuana. Some start as early as 8th grade or sometimes in high school. Found in drugabuse.gov, there have been 42% of people that were surveyed that of the age of 12 or older have actually tried marijuana. And according to the UN report on global drug use, cannabis was the world's most widely produced, trafficked, and consumed drug in 2010. Marijuana boasts somewhere between 119 and 224 million users in the adult population of the world, 18 and older. There are no signs There are no signs to indicate the popularity of marijuana will fall anytime soon. Cannabis is consumed in some fashion in all countries. The report says that it is grown in most. Though the use of the drug is stabilizing in North America, smoking pot is on the rise in West and Central Africa, Southern Africa, South Asia, and Central Asia. In 2010, marijuana was the most prevalent in Australia and New Zealand. The US and Canada came in second, following by Spain, France, Italy, and the Czech Republic. The UN report also noted shifts in cultural trends. Some interesting standouts. The European market is moving away from cannabis resin, which is hashish, and towards the herb, which is more popular also in America. Cannabis became Afghan's most lucrative cash crop in 2010, replacing heroin, and the marijuana seed market grew immensely in 2008 to 2010, with 100 to 200 brands available online when the report was written. The UN also reported that cannabis is becoming more potent in developed countries. The population of the hydroponic cultivation, a method that uses mineral nutrient solutions to grow plant without soil, means marijuana is more likely to be grown indoors and stronger than traditionally grown plants. There are some factors that more people might be more likely to use marijuana, and some of them follow. Structural factors such as age, gender, family background, and religious beliefs. Also, there are social and interactional factors such as the type of interpersonal relationships, friendship cliques, and drug use within the peer group setting. Settings such as the type of community and neighborhood, if they are available and use, and additional factors such as personal beliefs, attitudes regarding drug use, and personal factors such as self esteem, the level of security or insecurity, and maturity. That also as a factor is participation in after school activities is associated with higher levels of academic achievement and self esteem, as well as lower levels of substance abuse. And also, religious involvement affects illicit drug use. It is found that people that are more religious are less likely to do drugs. Medical marijuana can be found and prescribed for things such as cancer, glaucoma, HIV, muscle spasms, seizures, severe pain, nausea, and also dramatic weight loss and muscle atrophy. According to various state laws, medical marijuana can be used in treatment for other medical conditions such as Alzheimer's disease, post-traumatic stress disorder. Not all states that approve of medical marijuana have enacted laws to allow itself for all of these conditions. Other differences between states, the amount of medical marijuana that can be used and that can be in possession by the individual patient or primary caregiver varies, but also include dried marijuana of the live plant.